Okay, so with this week, we're going to be continuing the topic around athletics and ethics surrounding it. And we're focusing this week on health and well-being. So we're going to be speaking with Professor Register-Mihalik, and she's going to be telling us a little bit about how her work influences athletics, and we can see if we can find any ethical concerns or associations between her work and the work that we do with the Office of Ethics and Policy. So my name is Sierra President. I'm going to be conducting the interview. I am a junior and I am an intern here at the Office of Ethics and Policy. And Professor Register-Mihalik, can you introduce yourself?
Of course. Thank you, Sierra. It's wonderful to be here and have this important conversation about athlete health and safety in particular. As Sierra said, I am Johna Register-Mihalik. I am an associate professor in the Department of Exercise and Sports Science. I also am a faculty member in the Matthew Gaffeler Center, where we focus on traumatic brain injury and neurotrauma in sport and the military. And I am the co-director of the Star Hill Performance Laboratory, where we try and see how we can find creative and innovative solutions to movement, health, and rehabilitation issues inside and outside of sport.
Amazing. And can you tell us a little bit about what inspired your career path and how you got here?
Absolutely. So when I was growing up, I grew up in a small town in Slocum, Alabama, very small. Sports were a really centric part of that community, as they are in many communities, particularly in small towns. And that really drove a lot of conversation in my home, things I wanted to do in my life. So I was an athlete and I got injured. And when I got injured, I had an athletic trainer who actually provided care and supported me through that injury. I had stress fractures in one of my tibias, and this individual really sort of showed me a path where I could bridge this idea of medicine as well as serving others and sport all in the same capacity. And so that was in about the 10th and 11th grade where I really found this sort of field of sports medicine and athletic training and started asking questions about how could I do that? How could I integrate into that? So it was really my love of sports, trying to think about how to help and serve others, as well as, really wanted to be in some medical space that brought me to the place of my background in clinical athletic training. And as a result of that, I started asking a lot of questions. How do we keep people safe when they're playing sport? If they do get hurt, how do we help them recover and transition back into not just their sport, but to their life? And I started asking questions like that, really specific to traumatic brain injury, because of my experiences and seeing patients and athletes have these injuries and then take a long time to recover, or some people did just fine. So, what could we do better in the field of sports medicine, in athletic training, and as school personnel to improve those outcomes? And that really led to the research that I'm still engaged in today.
Yeah, that's awesome. And so it sounds like you've been involved with multiple parts of athletics. So like maybe as a fan, as an athlete yourself, and then on the sports medicine side. So can you tell us a little bit about how sports of any level or any skill can help a person with their health and well-being?
Yeah, that's a great question. Sports have an incredible set of positive benefits. They give us physical activity, which we know that are really beneficial to us. The average folks don't typically meet what we're recommended for in terms of physical activity, and sports can help us do that. Sports can also really help us feel engaged in our community. I mentioned earlier that I'm from a small town. And sports really brought that community together. It's where you socialize, you talk to other people. So they can really bring about a sense of community and help people gather around a common goal or selling point. They also help people grow and learn. There's many lessons that can be learned from sport. And there's lots of data to show the positive aspects of sport. As someone, even as children, engaging in more types of fun, less organized, and then the older you get, things becoming more organized, how that can benefit in terms of grades, persistence in school, being active in your community. So certainly there's these big aspects, sort of macro things that sports can give us, but personally, they help us get the physical activity we need. They help us find a sense of community and maybe being a teammate. And then they help us grow and learn.
Okay, yeah. So you talked a little bit about how sports impact youth. So do you think it matters what age or at what point someone begins sports in their life as to what the outcome will be with their physical and mental health well-being?
Yeah, I feel like there's a lot of questions when we talk about sport that it depends, right? I
Mhm.
think there's a sport for every age and across your lifespan, whether you want to start engaging, as someone who's 90 years old or someone who's 9 years old. There's different things that you can engage in that'll give you those benefits that I mentioned earlier, right? We call some of those lifetime sports, walking, things like tennis, golf, where you can engage in those across your lifetime. One of the things we try to think about is I'm also a parent of athletes. And so one of the things we try to think about for our kids is trying to play a sport where it's more individualized, one where they're more part of a team, and one that's going to be lifelong. Because not all sports can you continue through your life. And you want to teach them the value of physical activity and doing things in a healthy way, that you don't just have to be competitive to take care of yourself. So I think you can engage at any age and reap some of those benefits. However, because you are doing something that is physically active, injury is always a risk, right? And so that's where, athletic trainers, people doing work in different spaces come in to try to figure out, how do we mitigate as many of those risks as possible, to create the safest environment for people to continue to be active.
Yeah, I definitely agree. So what we're going to do now is transition to more ethically based questions, still on the topic of athletics and well-being. But just to begin, can you talk about how college sports should help balance the desire for high performance athletes right now at this point, and also pushing them through an injury with the responsibility to promote health and preserve a potential long-term career and keep their passion for the same sport?
Yeah, that's a great question. We could spend a whole week talking about all the aspects we could consider here. But I think one of the things that helps us think about this, at least in our work, we talk about different kind of models that help us think about what we should consider. And one of those is something called the socio-ecologic model, which allows us to think about how society and policy may impact this idea and this sort of intersection of being a high performer, but also being a human being, right?
Mhm.
And having these things that you need to continue.
Yeah.
How the community and organizations may contribute or fit into that. How interpersonal relationships, so all the people around an athlete, their coach, their parents, their teammates, their friends, us as fans, although us as fans probably fit more in that community, and then the athlete themselves. And so, one of the ways that within the college sports paradigm is really thinking about what needs to happen at all of those levels to promote a healthy intersection of those two things, right? So there's policy that can do that, right? Where we say things like, you can't go back to play on the same day that you're suspected of having a concussion, right? Or that you're diagnosed with a concussion. There are things in the community where you have community folks who understand now that concussions are bad, right? And so you talk about, I get what you're doing. You're taking care of your brain, right? We have things at the interpersonal level where a coach can encourage that individual and say, I want to see you healthy. Let's figure out what we can do to keep you engaged on the team until you're ready to go back and play. And then we have things those individual athletes can do, right? Whether it's programming, things like transition programming, that's a huge context of collegiate sport now, where we help people learn how to transition as an athlete through their sport and then out of their sport.
Mhm.
So those kinds of things are all things, but I like to think about it as it's not just on the athlete, right? It is all of these levels that really have to live in that tension of how to recreate the things, and I gave concussion as a specific example, but live in that tension of high performers and their whole human beings that we need to look out for their long-term health and well-being.
Yeah, so sticking with the conversation of concussion, can you talk a little bit about what injury prevention and concussion protocols we have now, and just how well you see those currently working, and if there's anything that needs to be changed in the future to kind of address them and make sure that they are working the way that they should for these athletes?
Yeah, that is a really great question. Thinking about the evolution of things over time.
Mhm.
Thinking about how, as we know more, we need to do better, right? And over time, we know more. I think it's Dr. Maya Angelou who says that when you know better, you do better, right? And we should do better. And so over time, we've learned a lot more. Some of it seems like common sense, like getting hit in the head too many times is bad. That doesn't seem like something we should have a hard time understanding. But just over time, because you can't see a concussion, for instance, right? It's not like an ankle sprain. You don't see swelling. You don't see an altered gait or someone walking funny. Sometimes you just don't see it. And so it was harder to really get people to grasp the fact that these injuries were happening and they could have both short and long-term implications. And now we know a ton more about that. We also know how we can treat it. We know that if you intervene earlier, that people have much better both short and long-term outcomes, right? We can do something to help you when you have a concussion. And so the protocols have changed dramatically. When I first entered this space in 2001, we returned people to play on the same day. As long as their symptoms resolved in 15 minutes, we put them right back in. There are studies that show that 75 to 80% of people with a concussion went back to play on that same day back 15, 20 years ago. We don't do that anymore, right? The medical paradigm has completely changed. As I mentioned before, we have a big overarching policy. If you're diagnosed with a concussion, you do not go back to play that same day. And then there's steps you take. We also see data that has compared NCAA concussions that happened in repeat within a season. So people getting multiple concussions within a season to more recent data. And we see almost no repeat concussions in a season anymore, or at the level we did in college sports, since we now have a return to sport progression where you separate the time when you get hurt to when you go back and play. Certainly those are on average. There's always situations that happen where those protocols aren't followed, right? We've seen those things. But what we know is when they are, the outcomes are better. And as we learn more, they will continue to change. Just this past June, the International Concussion in Sport Group put out their new consensus guidelines, right? Which changed that return to sport progression and allow for better introduction of rehab and early activity to help people re-engage with their teams and the things that are important to them. It has a lot bigger focus on return to learn and integrating those different roles. The same thing's true when we think about the way we manage ACL injuries or other things. We've just learned a tremendous amount, and we need to keep evolving and learning, and we have a responsibility to do that.
Yeah, I think being able to track and just make sure we're monitoring the progression of these protocols is really important. And it's really interesting how we can like look back on the past and say, oh, at this time, we thought we were doing what we could, but now we know better. So yeah, I think that's really important. Earlier we were talking about the community around athletes. So can you talk a little bit about how the role of coaches, trainers, referees, fans, anyone aside from the athlete can really impact how well they perform and also impact the pressure of the performance that they end up having?
Absolutely. So I'll go back to that model I talked about earlier, that socio-ecological model where you have these policies in society, you have the community, you have those interpersonal relationships, and you have the athlete. At all of those levels, our athletes feel pressure, whether it's on themselves, it's from their teammates, from their coaches, from their parents, from the community at large, or from policies that are being driven down towards them. They feel that pressure. And there's actually data in the concussion space to show that pressure from fans is actually part of their decision-making process in if they seek care for a concussion. And so I think sometimes as fans, I love sports, just like I mentioned before. Sometimes we forget what our role in this bigger society and that interplay of that model I just mentioned before may be in, what is happening, and our collective fan base might be on individual athletes' decision-making. And so, that's something, I try to keep in mind now as we've learned more about this, but it's really hard. It's almost like a group mentality, right? We have to start changing some group norms and expectations. And you see that happening through things in football, like a targeting call right now where you have to leave the game, right? If you get called for targeting, because you can't use your head as a weapon, you can't hurt someone else's head, as part of that process, but it causes a lot of controversy. If you've ever seen someone get ejected from a game because of targeting, right, there's a lot of support, and then there's a lot of folks on the other end, right, of that too. But that's another way that policy and rule changes can be used to make a game safer.
Yeah, I think that's really important that we know that how our role in different areas really impacts the game as well. And, just keeping in mind that being a fan is not as disassociated from the sport as some people may think.
Yes.
So looking at student athletes specifically, how do you think the physical impacts from the sport can also impact other parts of their life, such as academic performance or the formation of different relationships?
This is a really important question when we think about, student athletes being whole people, right? If we're talking about in the college setting or the high school setting. But even when we talk about youth or individuals as they go through life and they're recreational athletes, we are whole people where our mind and our bodies are intricately connected. And so when we are not physically well, there's other parts of our life that are affected. In particular with concussion, your brain is injured. And so you're going to have a hard time in many cases in your academic setting if you're a student athlete. You're going to have a hard time in a work setting if you're someone who got hurt in sport and you have a job to do, or you have to serve be with your family and serve others around you. It may even impact your social connections, right? Again, if it's a brain injury, those things can happen, but any kind of physical injury, right, is going to affect those other aspects of your life. And so making sure, like we talked about before, all those people you mentioned as having roles and impacting those athletes and participants is really thinking about how we create safer cultures for people to know that they are supported as a whole person, whether that's transition programming. It's also things like having an academic intersection with what's happening. So student affairs here at UNC is involved in how we can help people navigate academic issues after a concussion, so that there's good communication and connections across all of those spaces. Is really important because certainly physical health impacts all aspects of their life.
Yeah, so kind of alongside that, as someone who works in academics yourself as a professor, how do you help ensure that the next generation of athletic providers who may want to do something like what you're doing now can continue to adequately address the problems that we are facing and possibly even address ones that may come up later on in the future?
That's a great question in terms of how do we help provide the appropriate foundation and education for people who are going to go on and be care providers or work in the context of athletics. I teach an introduction to sports medicine class as part of our sports medicine minor in our class. And so I have a wide variety of interests, people who want to be athletic trainers, they want to be physical therapists, PAs, but some also want to be coaches or athletic directors. And so in that class, for example, we talk a lot about the whole person, that an athlete is a whole entire person. And when we are thinking about evaluating injuries, developing treatment paradigms, putting prevention plans in place, or risk reduction plans in place, we have to be thinking about the whole person and all the things in that model I mentioned earlier that could be contributing to the experiences that our patient or our athlete is having, because we may have to act or have action in all of those different spheres to see output. So we really challenge them to think about all of those levels. Again, thinking about beyond just your athlete is more than their ACL injury. Person first language, for instance, right? You have an athlete with a concussion. It's not a concussed athlete, right? Trying to think about how to consider an individual as a whole person and think about all of the inputs and outputs that really go into your patient's injury recovery, injury prevention, and the whole process that they're going through. So that's some of the things that we try and do, and really challenging them to think about some of the things we've talked about today. And sometimes they ask really hard questions, right? That we have to think about, again, all those levels and where could we act or change to make sure that we're thinking about our patients as a whole person.
Yeah, so focusing on thinking of athletes as a whole person, it's important, of course, that how they are feeling is known by people who are in your role. And since so many of these athletes have really strong passions for the sport, as we discussed earlier, how do you think we can ensure that athletes are not just simply pushing through the pain just so that they can continue with their sport without being properly and adequately checked out in case something is wrong with them?
One of those things, that I really think about here is having an organizational culture that illustrates we care about you as a person. But also a lot of things that happen in sport, it's really important what happens at the level of the team, because that's where they live and breathe and engage on a daily basis. So coaches encouraging them to take care of their bodies and their minds, right? And being proactive in that. And I mean that more from a day-to-day conversation perspective than I do from having a big meeting at the beginning of the year and saying, we care about you. It's really the actions day to day. And we see that from a concussion perspective too. So I'm carrying over some of the things we've learned in terms of concussion culture, that if coaches day to day is really helping people feel confident that they want them to take care of their brains and bodies, that when someone does get a concussion, the athletes see that coach valuing that other athlete, helping that person through that process, it really goes a long way to them seeking the care they need when they need it. The same thing is true for teammates encouraging each other. There's actually a good bit of evidence out there that show that peer to peer sort of engagement around these things can really actually help, right? In terms of, it's okay to do this, let me help you, let me go with you, here's what happened to me, can help some of that too. So it's about all those layers we've been talking about in this whole conversation, really thinking about sometimes complex, but a lot of times simple day-to-day actions that really create the culture that they're engaging in to help them seek care when they need to and how they need to, versus pushing through something that is going to be longer term. And the last thing I'll say about that is some of that is helping people understand that we all share a common goal. Mm-hmm. Is that if you're trying to help someone get better from an injury, it's not that you don't want them to play or you don't want their team to win or mm-hmm. that they don't want to win. It's that if they don't take care of their injury now, they're going to be out longer, right? It's aligning with the values of that athlete and the system that can also help that as well.
Yeah, of course. And just to like wrap up this discussion, can you just give it's going to be a really broad question, but can you just help us understand when sports or competitions can transform from being unhealthy to healthy, and how we can ensure that this doesn't happen along the process, especially in the sense of injury prevention and making sure that all of our athletes are well cared for?
Yeah, this is a really great question in terms of transition from healthy to unhealthy. And sometimes there's a really thin line, right? You've got this idea of sports teaching qualities like persistence, mm-hmm. Mental toughness, hard work, right? Which are all good things and have their place in certain things that we do, but not at the expense of our mind or our bodies, right? Mm-hmm. So really making that statement known, even from a young age. I always share a story around this, that once we were talking with some younger families of younger children, trying to help understand concussion care seeking in that age group. And we were interviewing a little kid who was in kindergarten or first grade. And we asked this individual, if you got hit in the head and you didn't feel well after that, would you keep playing your sport? Mm-hmm. And he looked at me and said, yes, and didn't elaborate. And I said, okay. And the parents were with us because we were doing these sort of dyad type interviews. Yeah. And he looked at me and said, well, I'm told I'm supposed to never quit. Mm-hmm. Right. And so it was one of those things where a good intent, right, results in this really sort of difficult decision for a really young child. And so, that's helped us really inform how we kind of do concussion education in younger families and age groups, that we help them understand that it's good to persevere, but if you're hurting, you need to take care of yourself, right? That's not quitting. Mm-hmm. And so really saying outright, that's not quitting. So it even starts from an early age, right, of helping people gain the perspective and then carry that with them. And doing those same things at every level of sport, right? You can't perform up to your best ability if you are unhealthy, right? Mm-hmm. And so helping them align the values that they have around sport with caring for themselves and their overall health and wellness, and having the whole organization do the same thing.
Yeah, I think that was a really good example that you gave, the story. And I think it really does show that values are really important from a young age, but also just as important whenever people grow up and continue their sports. So thank you for sharing that. I really appreciate it. And those are all the questions that I actually had planned to ask you, but I did want to see if you had anything else that you just want to add that we didn't already talk about in regards to health and well-being.
I think one of the other things that's really important in a high school and a college sporting environment where there's a lot of pressure, right? And a coach's job is certainly to develop individuals and win, but having trained medical professionals in those environments. So athletic trainers in high schools, our athletic trainers and other medical staff in the college environment is really important because their job and primary goal is to keep those athletes safe and healthy. So you always have those advocates and experts in that space. So a huge advocate for that. The other is that in these challenging environments, it's also really important that medical personnel report to medical personnel. So we call that unchallengeable medical authority. And it is a best practice in sport to do that so that when we make medical decisions, we're making them in the context of that medical chain of command and not being influenced by other aspects. And so that medical authority is really important, and creating that culture of the presence of medical authority and expertise is really a great way for athletes to also know that they have advocates to support them in those environments.
Yeah, that was amazing. Thank you so much for adding that in. Well, I just want to say thank you so much, Professor Register-Mihalik, for joining us and just for having this conversation. It's really amazing. And I know you took time out of your day, but I know that anyone who's watching this, whether they're on the athletic side or on the ethics side, will really enjoy this conversation and all the things that it brought up surrounding the importance of monitoring your injuries and making sure that you stay healthy and well throughout the whole process, no matter whether you're a young athlete or an older athlete. So I just wanted to say thank you so much again for joining us.
Well, thank you very much for having me.